So let's start talking about thriving in our industry. What an absolute honor we have to work in this industry, one where we constantly have the opportunity to touch people's lives at their happiest times, most tragic times, and sometimes their saddest times. And for us, as healthcare finance professionals, that is both a privilege and a tremendous responsibility. And in the course of our fulfilling that responsibility, we have faced as an industry a wide-ranging set of changes that we have had to tackle so that our communities could continue to receive the very best healthcare they could have. So I want you to think back to the 80s, and there are some of you who were not even born yet back then, but back then we tackled this crazy thing called diagnostically related groupings, our beloved DRGs. And somehow back then, we managed to really figure out what that meant. We understood the concept of a bundled payment for inpatient care. We learned about medical necessity. We learned about the concept of utilization. We have gone through massive legislative changes. And each and every time, we have figured out a way to make it work. We have faced new processes, new jobs, new roles, new systems, and new technologies. We have experienced the integration of services, the blurring of roles, and the merging of organizations. And so the number of changes that we have managed is absolutely endless. And you all know these things as you see them up here. So the important thing is that in the process of dealing with all of these changes, each and every time, we acquired new learning and a very deeper understanding of how to manage finance in healthcare. And every time, we had a choice, even if it didn't feel like we had a choice. And each and every time, we, as an industry, have made the choice to thrive. We worked hard to understand the implications of our financial statements, our revenue, our clinical care, and we worked hard to do the right thing and to thrive. Every single time we figured out a way to get to a new normal. So if our history teaches us anything, it teaches us that we can thrive. And as our industry continues to evolve to alternate payment models, to population health, to telehealth, telemedicine, robotic claims processing for accounts receivable, and digital everything, we will take it in and we will thrive.